these are comfortable when you show up on your day to validate people. So at your station, you're going to have this blue blood administration binder that's going to have the policy printed out. It's the same thing I emailed to you, that you'll just be validating that the people coming through the station are saying the correct order for the competency. So you're just going to want them to say that they are going to check that they have an order for the blood, how much, what type of blood product, and what flow rate, as well as the order to actually transfuse. They're going to review and pull up the blood policy. They're going to check that consent is completed. So the provider has to do consent with the patient, but then the nurse is responsible for getting or at least making sure that consent was signed. I did print out a copy so that you guys can have it here to reference. Then they will make sure the patient has appropriate IV access, notify lab that they have an order for blood, and then draw a type and cross if the patient doesn't have it already. And it goes through those steps here. So you'll verify your patient. I did bring in our board that we use for education. They're not going to have to go into these specifics, but if they have questions, again, I think this is a great opportunity to help educate some of the inpatient nurses that don't do this very often. But I did put the samples here that show one of the stickers from the blood band goes on the actual tube, and then depending on how much you're drawing, you just use a patient label and include the same information there. And then our little mannequin here has a pretend one around his wrist. And then if you had any orders for meds to give prior, you would give those or get them ready. Do all of your vitals right before you're going to administer the blood. When you go to check out the blood, you will go to lab, and we have our little fake blood here. So you're gonna do your confirmation with lab. You'll first check the actual patient label. So this would have the patient sticker here, but you're gonna be confirming, again, back to my little board here. This is the book that they'll have. This is a copy at least of one of the pages. And they're going to be double checking the patient label sticker with the blood product that you're checking out. So you can, again, just kind of reference this so the nurses can know, if they've never given it, what it's going to look like. And you're double checking the patient sticker as well as the actual unit of blood, double checking the number and the expiration date and the compatibility of the donor and the patient. And then once all of that is checked out, the nurse that's picking it up is going to sign here, date and time. And then also right here, they'll have to initial date and time. Okay. We do want to make sure everybody knows that the blood has to be started within 30 minutes from checking it out to lab. And if anything should occur, like they suddenly need to go to MRI or something else more urgent comes up, that blood has to be returned within 30 minutes for it to be refrigerated and used again. If it's over that, they have to dispose of it. And then they'll just talk about at the bedside with a second nurse how they're going to go over, again, same thing with the actual blood product and with the patient label. They're verifying the patient as well as the blood product with all of the information here. For the actual transfusion, we don't have enough product to have each person go through it, so I just have it set up here so again they can talk through that. They'd get their blood tubing Y set, they'd have their normal saline bag, they would prime through that, and then they would have their blood product. One of the issues or incident reports we've had is that this wasn't clamped off, so making sure they know that you would definitely have that clamped off so you're not infusing normal saline into the patient for 4 hours. So you can just have them walk through this. They have the product here to kind of talk through how they would prime everything. I have these here. Again, we're not going to actually hook it up to the patient, but they can talk about how they would clean the lumen, flush, attach the blood tubing, check the patient's vitals, again, right before administering program the pump for the appropriate volume to infuse in that first 15 minutes. Let's see, did I forget anything? Talking to the family and the patient about what to be aware of or what to report as far as a transfusion reaction. And then staying at the bedside for at least that first 15 minutes and then checking on the patient every 30 minutes after that. And then vitals should be documented every hour, again on that paper that they have hanging by the blood. All of this here. So they do have to double document. So here, as well as in the patient chart or in our paper documentation flow sheet. When they are done with the transfusion, if there was no issue, no transfusion reaction, they will just mark at the bottom here. Again, all of this would be filled out. They would say, no, there was no reaction suspected. They would ensure this was completely done, everything is marked, and then they would sign at the bottom date and time. This keeps getting missed because people think that's only if there was a reaction they have to sign here, but it's either way. Tell them just to think of it as ensuring that this whole paper is completed. Oh, I did forget to mention earlier with that double check, this is where they're supposed to sign off who checked the blood and who was their second nurse at the bedside verifying. So if there is no drippable blood, this would all be thrown away in biohazard. If there is a lot left, they need to return it to lab in a biohazard bag. What else I forgot here? I think that's it. So at least an hour after transfusion, they would again do vitals in the patient and monitor them, making sure that that note is added to the chart so that it pops up when they go to discharge to make sure that they get that post-blood blood product transfusion form that we frequently forget and get audited on. Yes, I think that's it. I'm reading through those, sorry. Okay, and then if there is a transfusion reaction, they should say that they would immediately stop the product, the blood product, and disconnect it from the patient. They would concurrently provide emergency care if the patient is having trouble breathing or dropping their blood pressure. At the same time, they would notify the provider or have someone immediately notify the provider. If they do get orders for a bolus, ensuring they know that they would set up a whole new tubing. We would never use the same blood tubing set. All of the stuff at the bedside obviously is primary, and then once the patient is stabilized, you're going to go through here, mark that yes, there was a reaction, everything that was completed, the provider that was notified, what happened, and then as well as in the chart, we would obviously we would say that we notified the provider and all the actions that were taken. And same thing, this would be signed at the bottom, date and time, and lab would have to be notified that there was a transfusion reaction. In addition to all of that documentation, they need to also complete an incident report and notify their supervisor. So that can just be the lead that would then notify the manager, but whoever their supervisor is at that time, they need to make sure they are aware. All right, so I hope that answers any questions and that you guys feel comfortable with checking people off tomorrow. Again, this is in that email. The policy is written right behind it. And then the forms will all be here for you to reference to. So we will see you guys later this week. Thanks again for helping with this.